The following is a demonstration of the TCC-EZ total contact cast application process. The TCC-EZ cast comes in two sizes, a 3-inch diameter cast and a 4-inch diameter cast. If you are unsure of what size to use, ankle and calf measurements can assist in making the decision. The goal is to optimize the fit to lock the foot and leg into the cast to control motion and achieve total contact with the patient's foot and leg. However, some foot deformities may not be accommodated by the TCC-EZ. Therefore, the clinician may choose the Medicast Ultra for TCC offloading. All of the components required for this total contact cast are included in the TCC-EZ system. A patient information sheet is also included. Be sure to review the patient instructions and give them to the patient. Step 1. Foam dressing. For the primary dressing under the total contact cast, it is recommended that you use an absorptive polyurethane foam dressing without an occlusive backing. This will prevent excessive buildup of exudate that may result in peri-wound maceration and compromising the wound. Do not use occlusive primary dressings under a total contact cast. The recommended wound dressing should be low profile. Do not use a bulky dressing to avoid creation of air pockets and reduction of total contact. The dressing should match wound characteristics and the wear time of the cast. You may elect to use one of the several alternative foam dressings that are available in the market. Step 2. Tan Stockinette. Next, gather the tan stockinette and slide it over the foot and leg up to the knee and smooth out the wrinkles. Gently tug on the end of the stockinette. Fold the distal end of the stockinette over the dorsum of the foot, leaving about 2 fingers width of room at the top of the toes to avoid binding or pressure on the toes. Secure the end using plastic tape and cut the excess. Step 3. Protective felt pad. At this point, the patient is asked to hold the foot perpendicular to their leg. Apply the protective felt pad with the shorter, narrower portion from the tibia crest over the dorsum of the foot and along the bottom of the foot past the heel, ending at the Achilles tendon. Ensure that the malleolus discs cover the bony ankle prominence and anchor the pad with the plastic tape. Do not tape around the circumference of the leg. Leave a finger's width between the toes and the padding so as not to impinge the toes. Trim the corners at the heel for contouring around the heel. Cut the excess padding at the top, allowing for 1 to 3 inches of excess padding beyond the widest part of the calf. During the application, the patient's foot must be at 90 degrees to the leg or the padding will wrinkle. Step 4. Thick white sleeve. Apply the thick white sleeve sock over the protective felt padding. Start by rolling it into a 2-inch roll in the shape of a donut. Place the sleeve over the foot and use your thumbs to unroll the sleeve, stopping just short of the tan stockinette at the knee. Ensure all protective layers are not being disrupted and are not binding the toes. Tug on the white sock and fold over the toes toward the dorsum of the foot, maintaining room at the toes. Secure with plastic tape at the base of the toes and trim the excess. Step 5. Proximal cast edge. Cut the excess felt padding at the knee, even with the thick white sock, and fold the proximal end of the tan stockinette back to complete a finished edge. Step 6. Patient positioning. Place the patient on their stomach in the prone position. While the patient is sitting in the exam chair, recline and tilt the chair to elevate the leg as much as possible. In this position, gravity will assist to shift soft tissues towards the knee while the clinician is molding the cast. Doing so allows for total contact, especially around the ankle. The vast majority of patients can move into the prone position. However, on occasion, patients may not be able to roll onto their stomach. Good examples are patients with congestive heart failure, pregnant women, someone with a highly protruding abdomen, or a patient who has had recent abdominal surgery. Although it is not optimal, the TCC-EZ cast can be applied in the alternative supine position. To protect the patient's clothing, you may drape the patient. Flex the knee and the ankle to 90 degrees and position the foot in a neutral alignment. Step 7. Cast sock. Remove the cast sock from the bag. Roll the cast sock into a 2-inch donut shape, leaving about 1 to 2 inches of unrolled sock. This is known as the tail. Use the colored stripes to align your roll. Avoid any wrinkles and maintain the donut shape while rolling the cast sock. To ensure thorough saturation and activation of resin, immerse the rolled sock in 70 to 80 degrees Fahrenheit water for approximately 10 seconds and gently squeeze and shake out any excess water. Set the rolled cast sock on the toes and using your thumbs, unroll the cast sock, leaving a 1 to 2 inch tail. The placement of the colored stripes is not important. Gently unroll the sock towards the knee, using your thumbs to push and stop at the widest point of the calf. Position the patient's foot in plantar flexion and use your flat hand to smooth out any wrinkles. It is very important to remove all wrinkles as they can cause irritations. Fold back the excess cast sock over the dorsum of the patient's foot and hold in place. To complete a finished edge, roll the proximal edge of the stockinette distally, covering all loose edges. Then fold back any excess cast sock to the widest part of the calf to shorten the cast length. Using wet gloves, contour the cast to the leg, ankle area, arch, and Achilles tendon region, paying close attention to mold around the ankle area for approximately 2 to 3 minutes. During molding and contouring, continue maintaining the foot and ankle at 90 degrees until the cast is firm. This takes approximately 2 to 3 minutes. Step 8. Dry time. The patient can now be returned to a seated position with the cast suspended over the edge of the chair. Allow the cast to dry for approximately 15 minutes until the cast is cool and hardened. With the design of the TCC-EZ cast, it is normal and expected to have flex in the cast even after it is fully cured.